Acute appendicitis. Today's disease of the day. What is it? Okay, well, what's an appendix? Well, what does the word even mean? Acute appendicitis? Okay, well, let's break it down. Acute, something that happens really quickly, and typically things that happen which pack a real punch when it comes to being painful. Appendicitis, break down the word. Appendicitis. So, appendix and itis. Itis means inflammation, and appendix, well, let's figure it out. In English, an appendix means the end of something, and it's typically used to refer to other things. In medicine, the appendix is technically, some might say, at the end of the digestive system, and as a result, we refer to it as an appendix. Let's get more specific. So, I want you to imagine that you have a digestive system which runs from your mouth to your anus. Now, at some point, your food travels from your small gut to your large gut, and it passes by the ileum in the small gut towards the cecum in the large gut. There's a funny, almost appendage connected to the cecum, and we call that the appendix. Specifically, it is retrocecal in most patients. What does retrocecal mean? Well, break the word down. Retro, which means behind or going back, and cecal, well, behind the cecum. So it's a retrocecal structure, which, let's be honest, we don't really know what it does. A lot of people say that it's a lymphoid organ, which means it has some connection with the immune system. However, the research on that's not very concrete. Okay, so we know what it is, but why should we care? Well, for one reason really, so that it doesn't burst and spread bacteria everywhere, because that's what happens in a ruptured appendix, which we'll get into. So, acute appendicitis. What can happen, and this happens in a lot of people for not a lot of well understood reasons, but this typically is seen in people who are younger of age and can happen in both males and females. Acute appendicitis happens when the appendix gets inflamed. As a result of the inflammation, we get what's called periumbilical pain. So, pain found near the umbilicus, which is the belly button, and slowly that pain will move towards the right iliac fossa or the right hip joint. So a patient might say that the pain has been moving, or they might just say that it started in the right iliac fossa from then on. This pain is extremely distinct to acute appendicitis, but should not be confused in a patient who is a female and of childbearing age, because, take a guess, what also could look like acute appendicitis? Ectopic pregnancies. Ectopic pregnancies can mask as acute appendicitis, which is why one of the first things we order when we are looking for acute appendicitis and don't want to get it mixed up with ectopic pregnancy is a serum beta HCG in any patient that walks into A&E who's a female of childbearing age. Now, let's move forward. What happens is when the pain moves, they will also exhibit other signs and other symptoms. For example, they may complain of nausea and vomiting as a result of the sheer pain that they're experiencing. They might start experiencing pain on both sides. So palpating the left hip joint starts creating pain on the right for some reason, and we call for some reason to them, and we call that Rovsing sign. This is typically because the referred pain starts spreading towards the other side, and upon palpation of that side, you'll still feel the pain on the other side as well. Referred pain is weird, but it's essentially how pain can travel in places where it's really not supposed to be. Kind of like when a spleen ruptures, you feel the pain in your left shoulder. Referred pain. It's to do with embryology. It's too complicated for me. But anyway, the point is, this is another sign that we look out for. We have a few other signs that we look out for, such as the psoas sign. The patient lays back flat on their back, they lift their leg, we find that they'll start to complain of pain in the same area. Obturator sign, so they put their leg back and put their leg out, and they'll complain of pain in the same area again. And when we examine them, if we were to press down on that area, they might experience pain in the periumbilical region. And specifically, and this is a real kicker for your exams, there's a specific point between the periumbilical area and the right iliac fossa. Draw a line. 1/3 of the way from your right iliac fossa to your umbilical area, to your belly button, is a point called the McBurney's point. Press down on it, and the patient will scream like there's no tomorrow. As a result, we also look for this and what's called tenderness in McBurney's point for acute appendicitis. Okay, so we've got a clinical idea of what to do, and we've kind of just seen the patient, we kind of understand what's going on. But what I want to understand now is, well, what do we do next? Okay, first of all, any acute case, we should do an A to E assessment. So we check their airway, can they talk? Are they breathing well? Do they have good circulatory signs? Are they showing any signs of disability? And everything else. We typically just skip straight to E because none of the other things should pop up anything in particular. And acute appendicitis is unique in that it's very good to diagnose clinically, but to confirm, in case you want to support your diagnosis, we can also do a CT scan. However, it is not required to start the next line of treatment, which is antibiotics. Starting antibiotics is key because this way we can clear out any infection and potentially avoid an appendectomy, which is the definitive treatment for any appendicitis. What does appendectomy mean? We'll break down the word. Appendix, appendectomy, Tommy. Appendix, we've already discussed what that is. And Tommy or otomy just means removal of. Yeah, cut the appendix out. Cut the problem out. Okay, so now we've understood what is an appendix. We've understood the problems that can happen with an appendix. What might a patient complain of in acute appendicitis? What are some investigations we can order? What to look out for in terms of ectopic pregnancy so that we don't confuse it with an acute appendicitis? What's the management? And there we go. Let me know if you found this useful.